Hello everyone, Kent Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, podcast endorsed and sponsored by kidneysolutions.org. Hello everyone, this is Kent Bressler, and we're going to do some podcasting in hopes that I can enlighten you on a new bill that is being worked up by NephCure, and this bill is a very interesting one. So we're going to talk about it this morning, and it has to do with kidney disease. Let's start with prayer. Dear God, life's challenges sometimes seem insurmountable, and our spirit feels weak. Grant us inner strength to face adversity with courage and resilience. Fill our hearts with unwavering faith and confidence in your divine power. With you by our side, I know we can overcome any obstacle that comes our way. Thank you for being our rock and our fortress. Amen. I get to go to Washington, D.C., Kathy and I did, on July 24th. And what we went to D.C. for was for Rare Kidney Disease Day on the Hill. Got to go and talk to our congressmen and our senators. And what we talked about was this new bill that we're trying to get off the ground. And NephCure has been a major producer of emphasis on this particular bill. We had roughly, I think, 70-some people that were in attendance from 22 states. And there were 81 plus congressional offices that were engaged in our advocacy efforts. And what was so nice about it, we were able to secure 8 new co-sponsors for the New Era Act, bringing that total now to 14 co-sponsors. We're going to continue to chase this bill. We're going to continue to encourage you as kidney disease patients to help us with this bill. I want to do a special thanks this morning to Matt Johnson, the NephCure Director of Government Relations and Advocacy. He did an excellent job of coordinating this entire process, and he has vast experience in the advocacy world and working with Congress, and we are very fortunate to have him at NephCure. In addition, Josh Tarnoff, the CEO and Executive Officer, spoke at the engagement and our dinner on July 24th in the evening, and enlightened us with all the things that are going on with NephCure. Also, I'd like to thank Grace Murkowski and Kyle Matus. Both of these folks have an extremely good way of producing and letting people know about governmental agencies and how they operate. And also to Mark Coronel, a patient advocate from California and a good friend who did a very, very nice job
giving us tips on how to handle ourselves on the Hill and how to engage the staff and the on the Hill when we went to see our representatives, giving us excellent tips. So I thank him for that, doing that. I'm sure I'm going to miss somebody like Brittany Dorman, who is the executive director of strategic relations, who directed some training the night before we went to the Hill. And also, I want to thank project coordinator Kelsey Clements for a job well done. All this background stuff is the major reason why things like this Hill Day is successful. We just really had a good time, and to be in the area and be associated with all of the folks with kidney disease and their caregivers just made it even better. You get to learn about a lot of different types of kidney disease, but mostly what we were worried about making sure is that everybody's comfortable. And that happened. Had a great venue, a great hotel to work out of. And we really did have good coverage from all the staff at NephCure. And I want to congratulate them for a wonderful job done. If I've missed anybody, sorry, that's my bad. But let's get into this bill because it's very, very important to me and to a lot of people in the kidney world. And you may not know anything about it. And before we even start this overview of this bill, I want you to know that your voice is very important. You can't imagine how important it is for congressmen, your congressman, and anybody to hear the story of kidney disease. It's a very quiet, progressive disease, and a lot of us have a tendency not to want to talk about it, but we have to. We have to bring it upon ourselves to educate the community, educate the legislators and the researchers. It's very, very important for us to be vocal and, to be honest with you, kind of pushy, because this is our life. And without it, without this encouragement that we get, and without this knowledge, and without these bills, and without research, well, things just don't work out for us. You have to be able to vocalize and tell of your experiences and not be afraid to do that. You didn't ask for this disease. You didn't ask for kidney disease. You didn't put yourself in a position to accept it. But now that you do and you have it, it's time to be vocal. You need to stand up and go ahead and tell people about kidney disease so we can get more research dollars, so we can get some of these bills passed. And then try to get a bill passed is very difficult nowadays. It's not easy. And it takes lots of work and a lot of ingenuity and planning. So after that little lecture, I just want to encourage you, if you have any questions about this bill or any question about how advocacy works and you want to be an advocate, give me a call, 830-285-2140, or go to nephcure.org. We have people there that can handle any of the questions that you have, and we need more volunteers. We need more people willing to work in the kidney space. So we welcome you. All right, enough said. HR 6790, the New Era of Preventing End-Stage Kidney Disease Act. It's a lot of words for what they've cut it down to, and what you'll see it written up about is the New Era Act. And it's bipartisan. It's federal legislation that improves outcomes and quality of life for hundreds of thousands of Americans who live with a rare kidney disease, or RKD, and also for their families. And this New Era Act supports early intervention and access to appropriate treatment, and reduce the human and economic impact of RKD, rare kidney disease, We're going to do that through research, improved diagnostics, and physician and patient education. It actually, this rare kidney disease, if you think about it, it's a driver of chronic kidney disease. And the precursor and the following of this is kidney failure. And that cost Medicare, and believe this, 124.5 billion with a B dollars a year. Although we've had a significant surge in research, and let me tell you, NephCure has led the way in this, it's still not enough. It's a late start, and we have a lot of people coming in the pipeline who have this disease that need this type of research and this kind of attention. So Congress has got to prioritize and advance that, and we don't have much time. It's going to drop down. The 118th Congress is going to be over. We're going to have to reintroduce this whole process. Okay, fine. We'll do that. But you need to be ready. All right. So what does this bill do? There's really about 5 different areas that we can break it down into. What it would do would require the Health and Human Services, or HHS, it's going to ask them and make them evaluate treatment methods that would delay or eliminate the need for dialysis or transplant, and provide the legislative recommendations to Congress with supporting and their findings. It also requires a report to Congress on how slow RKD progression, slowing that progression, what kind of strategies can be used. And there's a simple way of doing this particular aspect, this reducing kidney failure. Let's do some screening. It's only appropriate, and we've talked about this in our support group. We've talked about this in different channels that we work with in community, in the kidney community. And it's so simple. It's as simple as a routine urinalysis and genetic testing. Simple. A simple routine urine test for protein in your urine. Very inexpensive. Genetic testing can be used, and it's coming down in price, and it's something that we need to be looking at very carefully. But just if you go in and talk to your doctor, chances are when you go for a routine physical at the doctor's office, they don't even do a urinalysis anymore. If you go in for follow-up care, there's no urinalysis done. It's so simple and easy to just do a dipstick on that urine to find out if you got protein. Because if you have protein in your urine, the bells and whistles should go off. You shouldn't have it. It is an indicator, one of the main indicators for kidney disease. Early detection. If you know it, you can treat it. If you don't, you're losing time. You're backing up. So that's how we could reduce kidney failure. All right, the second aspect is looking at this in the underserved communities. This act would direct HHS to make recommendations that would improve care in communities that have disproportionate rates of RKD. In other words, lower numbers of people with higher numbers of the disease process, all right? Typically the Black and Hispanic communities of color, they're at high risk, totally high risk for RKD. And that's something we need to address. And this study range relating to intervention and testing and treatment fits right in the bailiwick working with these traditional communities. It's impactful. It would tremendously reduce the barriers that we have for screening and for finding this disease process early on. All right. So we're asking, in this bill that they HHS address underserved communities. They've got to look at that. They've got to put emphasis on it. All right. The third area is advanced research in the standard of care. This New Era Act will create regional centers of excellence on rare kidney disease. The research that goes on at the National Institutes of Health will support research, public awareness, and resources that would lead to innovative, less invasive procedures and treatments, and possibly a cure. These centers of excellence would be able to share expertise that would improve uniform standards of care, reducing the likelihood for poor or variable health outcomes among our KD patients. In other words, focusing on access, number one, but standard of care, developing the standards and advancing research. Those three things in itself are the most important part of this bill, in my opinion. Another area, is a fourth area actually, is improved healthcare provider education. This New Era Act establishes nephrology fellowships and provides continuing education and primary care training on RKD diagnosis and treatment. This training will improve physician knowledge and increase the number of experts available to patients. And to believe it or not, within the nephrology world right now, there are only 200 doctors, nephrologists, who focus on rare kidney disease, that have the expertise to care for people with rare kidney disease. 200 for a population of 30 million. That number doesn't add up, doesn't make sense. In order to go in and become a nephrologist, it takes years and years of training. And I can tell you that's why it's so busy within this whole transplant process and this whole end stage of the, there's more and more ASRD in our communities now than ever before. All right. It's like the 10th leading kidney disease, 10th leading cause of death. I came with, and just in the transplant world, 13 people die every day waiting on the kidney. So this premature, not really premature, preemptive attack on kidney disease is where we need to be. We don't need to be treating symptoms, and we need to be treating early. We need to find it and treat it, and at least get people on the radar and educate them. And that's what these centers of excellence and research does. Okay, then the last thing is empower patients and communities. This act will support public information and patient education campaigns. Over the years, we've seen a major influx on TV commercials and national public awareness programs for things like heart disease, cancer, diabetes. All of these disease processes get wild, vast attention. Kidney disease doesn't. And rare kidney disease, nephrotic syndrome, gets very little. And that's what needs to happen now in media. The media needs to pick this up, and the government needs to go ahead and think about how they can make agencies that already exist, like HHS, stand up and come up with programs that will educate the communities about rare kidney disease. By empowering the community, by empowering you, that means the patient, they can take charge of their own healthcare journey. We've always said that. It's not up to others, it's up to us to navigate this course of kidney disease. And we cannot do that without education and research. And this bill covers all of them. So it needs funding. And it needs to get on the board. It's just starting. And so there's plenty of people that are willing to do the legwork to get people interested in it. And we saw that with the 70 some people that were at the Hill Day. It was a successful drive to educate legislators, but that's not enough. You need to pick up your pen, or look online, and go to your agencies and ask them, your legislatures, if they would step up and co-sponsor this bill, HR 6790. And I think that would in itself make sure that you're part of this whole program. Without our voice, without our stories, nothing will ever get done. And if we hold it to ourselves and don't share it, it's really not good for us. And it's not good for kidney disease. We want to stamp it out. And I think NephCure, if you really look at this heavily, NephCure's mission, if you have rare kidney disease, it's to empower people with rare protein-spilling kidney disease to take charge of their health while leading the revolution in research, new treatments, and care. So go to nephcure.org and check this out. All right. It won't take you very long to look over something you have interest in and share this with other people, and specifically share the bill, HR 6790. I'm going to be doing a series of these podcasts on this particular bill and how actually NephCure is working and how it reflects what is needed in the rare kidney disease arena. And I do really want you to understand that this whole process, rare doesn't mean it's very little of. It just means there's a lot of it, but it's not spoken of very much. We need to take the rarity. It needs to become the same as diabetes, heart disease. That's the kind of arena it needs to be in, and that's what we can and will do with it. Okay. I think that's probably enough about this bill. I do know that in order for us to do these type of particular things on Hill Day, there needs to be participation by the larger companies that are into the research. And the sponsors for this particular program that we did was Travere Therapeutics and Novartis. And I want you to know that if you have any issues, or if you want to talk about advocacy, and this bill particularly, I want you to call Matt Johnson. He's the Director of Government Relations and Advocacy. And his office number is 610-540-0186, extension 46. That's 610-540-0186, extension 46. Make sure you just reach out to everybody and ask them to listen to this podcast about HR 6790, the New Era Act, the New Era Preventing End-Stage Kidney Disease Act. Okay. So I think that's enough on the Hill Day and this New Era Bill Act. Have questions, give me a call. Be more than happy to let you know what's going on with it. And I need volunteers for this. Give me a call and I'll tell you how you can make an impact in the kidney world for rare kidney disease, especially nephrotic syndrome. Okay, so till the next time, keep breathing.